Thank you, Mr. President. I rise today to talk about an issue that's important to all of us. We are obviously a nation in a transition. Recently, the Senate took the first steps to repeal Obamacare and begin a transition towards policies that will ensure continued access to health care with more affordability and flexibility for all. A stable transition. We need a stable transition that will empower Americans to make the best health decisions for their families. In my home state of West Virginia, Obamacare has been very, very difficult for many. It has meant skyrocketing premiums, skyrocketing copays, and deductibles for families and small businesses. It has meant little, if any, choice in insurers. As a matter of fact, for the first several years, we had no choice. We do have 2 insurers in several counties, but in the beginning, the entire state had no choice. And has meant fewer choices in doctors and hospitals as networks shrink and plans become more restrictive. Now we must repair what can be fixed, scrap what's not working, and create a better health care reality for all Americans. I've spoken with small business owners who have absorbed the cost of increased insurance, but their employees are getting less coverage. I've spoken to families who may have health insurance, but due to the high deductibles and copays, they don't use it. They can't afford to even go. I've also heard from those in my states who have real concerns about what this transition will mean to them. This is especially true for those who receive coverage through Medicaid. My state is one of the states that did an expanded Medicaid. For all of these West Virginians, and there's somewhere between 177,000 new folks who are on Medicaid, for all of these West Virginians, whether they're the Medicaid recipients, the business owners and families who are currently struggling, we need to have health insurance that works for everybody. So I want them to know, and many of them have called my office, and I've talked with them a lot in our state, that I'm listening and hear your concerns. So as we move forward, I'm working to balance each of these needs and ensure access in West Virginia and across the nation to affordable, quality health care. To achieve this goal, I am joining Senators Cassidy, Collins, and Isaacson to introduce an alternative to Obamacare, which was introduced yesterday. It's called the Patient Freedom Act. Sounds good. We're really good about making names that sound good, but the Patient Freedom Act lives up to its name. The Patient Freedom Act of 2017 removes Obamacare's most burdensome regulations. It provides our states, the ones closest to the people who are accessing health care, the opportunity and funding to ensure those currently covered by the Medicaid expansion are protected and retain their health coverage. It returns authority to the states and provides more health care choices and better insurance options to individuals and families. It keeps important consumer protections such as coverage for pre-existing conditions and extends coverage to children and dependents through the age of 26, very popular parts of the ACA. It protects the federal Black Lung Benefits Program, which is especially important in my state of West Virginia and the surrounding areas. In addition to all of those important changes, it gives states a pathway forward for replacing Obamacare. Specifically, following repeal, which we know we are going to do, states would have 3 options. First, a state, if it so chooses, could choose to reinstate Obamacare. Or a state could go without federal assistance and opt not to receive any federal funding for tax credits or Medicaid expansion. Finally, a state could choose an innovative replacement plan where the state determines its own insurance regulations. In this scenario, the state would be eligible for 95% of the funds it would have received under Obamacare, and the Medicaid expansion would be fully funded. For a state like West Virginia, that has already expanded Medicaid, as I said, the state could either keep its Medicaid expansion as is, or they could convert it to subsidies to help individuals purchase private insurance. Under this plan, individuals would use a Roth Health Savings account to purchase health care. This would enable uninsured individuals to purchase health insurance that meets their specific needs. States would have the option to auto-enroll uninsured individuals into a standard health care plan, with individuals would be easily able to opt out if they didn't want it. Auto enrollment would ensure stability and soundness to our insurance markets. The Patient Freedom Act is a smart, innovative way forward and meets the varied needs of people in my state of West Virginia and across the country. The legislation reflects Senator Cassidy's experience as a physician, and I thank him for his innovation. He's worked with patients who are uninsured, and I appreciate his leadership so much, as I do Senator Collins in particular and Senator Isaacson as another co-sponsor. As other replacement plans are drafted and introduced in the Senate, I will evaluate those proposals to ensure they meet West Virginia's health care needs. I'm committed to replacing Obamacare with a system that offers us more choice. We can figure this out. We know what we need. Lowers costs and gives patients and families more control. Because together we can achieve a health care system that works for everybody. So thank you very much, Mr. President, and I yield the floor.